And for pathogens to spread, there's 4 conditions that have to be met. There has to be a pathogen present. You have to have enough of the pathogen present to cause disease. The pathogen has to get in through an entry site, and then you have to be susceptible to whatever the pathogen is, so you don't have antibodies built up to hepatitis B or something of that nature. And there's a lot of misconceptions and stigmas out there about hepatitis and HIV in particular. They're most commonly contracted through unprotected sexual activity, sharing needles, and other high-risk activities. Those aren't the only ways that they've been contracted, but those are some of the more common ways of contracting them at the current time. So there's a lot of stereotypes about HIV and hepatitis that you're all aware of. But we know that infection doesn't happen through casual social contact. You're not going to get hepatitis or HIV through hugging, through social kissing. And when we talk about social kissing, we're talking about a peck on the cheek. Every once in a while, somebody will say, well, I thought you said, bodily fluids can transfer pathogens. You're exchanging bodily fluids. We're not talking about a social kiss. We're just talking about a peck on the cheek, no bodily fluids being exchanged. You're not going to get it from holding hands. You're not going to get it from hugging, as I mentioned. You're not going to get it from somebody coughing or sneezing. You're not going to get it from using a fork somebody's used if it's been washed and cleaned. So we're not going to contract it through those common ways. Okay. Any questions about any of that information? Okay. So our protection against getting any sort of pathogen it starts with universal precautions. And our general guidelines to protect yourself from bloodborne pathogens is that we want to treat all blood and all bodily fluids as if it's infected. And that's common sense. We all know that. The challenge that I think we have in the healthcare field is that for us to successfully do our job, we have to have really good relationships with the people we serve, and we've got to have really good relationships with the people we work with. So over time, you become very comfortable with the people you're interacting with. And because of that, we can tend to let our guard down a little bit. But no matter how well you know somebody, no matter how well you know a client, we always want to assume that any sort of blood or bodily fluid is infected, and we want to treat it as such. We use the universal precautions anytime we provide care or anytime we clean up spills. And if an injury is minor, and it's age and developmentally appropriate, we want to have the person provide first aid to themselves. So if we have a 15-year-old that is functioning at a 15-year-old level, they fall down, they scrape their knee playing basketball, we want to let them put the bandage on their knee and clean out the wound, rather than us doing that. If it's a younger youth, or if it's somebody that's developmentally delayed, we may help out with that. All right. And I mentioned this before, but we're all at risk. If you come into contact with other people, you're going to potentially come into contact with pathogens. And especially working in environments where you're going to be in close quarters with others, you're a little more of a risk just because of that close contact and proximity of others. Standard precautions are some of the most effective ways of protecting ourselves from pathogens. And one of the most important standard precautions starts with personal hygiene, and that really comes in the form, most importantly, of washing your hands. We all wash our hands, but again, we get busy. There's a lot of things we have to do, so sometimes we may cut some corners on washing our hands. Really important that we do that in the correct way. And if we're washing our hands according to recommendations, we're using liquid soap, not a bar soap, but we use liquid soap. Make sure that we're using really warm water. And then we're going to rub our hands vigorously for 15 to 20 seconds. And as you're doing so, you want to make sure that you scrub your fingernails against your palms, because fingernails are areas where bacteria tends to hide. And then we're going to use warm soap and water to rinse our hands. Dry your hands thoroughly with a paper towel, if at all possible. And then you feel a little neurotic when you do this, but you use the paper towel to turn off the faucet, and then to open the door to get out of the bathroom as well. Does everybody do that already?
Most of the time.
Anybody feel strange doing that? Yeah, you feel a little neurotic doing that. But again, no matter how well you know somebody, you don't know all their habits, and we don't know. We've got lots of guests that come in and use our facilities. And if you're in a public area, I don't know what it's like in girls' public restrooms, but I've been in enough men's restrooms, and I can't tell you the number of times I've seen guys come out of a stall, shaking their hands dry. As I'm looking in the mirror washing my hands, somebody will shake their hands dry as they're coming out of the stall and go straight for the door without washing their hands and pull open the door handle and walk right out. So if you've taken all the care of washing your hands, not touching the faucet with your bare hands to protect yourself from getting any additional pathogens, and then you go right to the doorknob, which probably has lots of pathogens on it, and you open it, you're reversing everything you've done potentially. So it feels a little neurotic, but best protocol to use when we're washing our hands. And there are a lot of hand sanitizers that are out there now, and particularly in this area, where you're so isolated and you're doing lots of traveling, lots of transportation, it's good to have hand sanitizer available. But you're not supposed to use that in lieu of washing your hands. Washing your hands is much more effective at eliminating pathogens than using hand sanitizer. You can use hand sanitizer after you wash your hands if that makes you feel more comfortable, but you shouldn't use hand sanitizer in lieu of washing your hands. If you don't have access to soap and a sink to wash your hands, you can use hand sanitizer until you can get to a sink and wash your hands. And I wouldn't make any judgments on anybody doing this or not doing this, but just so you know, the CDC recommends that healthcare workers not wear artificial nails, and that your nail length is no more than 1/4 of an inch past your fingertips. All right. Protective equipment that you should have available consists of gloves, goggles, or some sort of face shield, a gown, breathing barriers, biohazard bags, sharps containers, and disinfectant. You guys have all those things available at Hawthorne, do you know? Mm-hmm. Okay, good. Yes. Good. There may be times, and especially if you're transporting youth from place to place or to appointments, you may be in a situation where you don't have all of those things immediately available. If you don't have red biohazard bags, you can substitute and use hefty bags. The key is that you have to dispose of those immediately according to whatever department you're in and whatever landfill policies and procedures that you need to follow for the area that you're in. You don't want to leave a normal hefty bag with biohazard material in it just laying around the house, because if you do that, there's a likelihood that somebody's going to treat it just as trash, and people tend to sling trash bags over their shoulders or just toss them in the car. They're not as careful with those. So there's a lot more likely that a tear is going to happen and we're going to have a leak. So we want to make sure that if you're not using a biohazard bag, that somehow you're labeling the bag as biohazard and that you're disposing of it immediately, not leaving it where it is. And if you don't have an actual sharps container, you can use any sturdy plastic container. Detergent bottles potentially can suffice, just as long as you can seal it. It's not likely to be punctured by the sharp, and that it's not going to be likely to leak or spill. And again, if you use something other than a sharps container, you want to make sure that you label it as such. And guidelines for using protective equipment starts with gloves. We should always have gloves available, and whenever possible, we should have latex-free. Increasingly, numbers of folks have allergies to latex, so if we have latex-free gloves, that's the best approach to use. And you use gloves whenever you provide care to somebody that is injured or somebody that's sick. And again, a lot of times we're caring for folks that we've got good relationships with. We know they've got the flu. We want to go in and provide care without gloves, but if we're following protocol, we're going to use gloves before we provide care to somebody that's not just injured, but somebody that's sick. Remove any sort of rings, watches, or any sort of other jewelry that might tear a glove before you put it on. If you have any cuts or scrapes or open wounds, cover them up with a bandage before you put the glove on. And obviously don't use gloves that are torn or punctured, or if they look dried out or discolored. If there's any possibility that they're not going to hold up, err on the side of caution and don't use them. Obviously don't clean or reuse gloves. Every once in a while somebody wants to joke and say, well, can we just turn them inside out and reuse them? Just throw them away. Use them once and dispose of them properly. Adults tend to want to touch our face about 15 times an hour. So after you've provided care for somebody, even if you've used gloves, you want to dispose of those gloves and wash your hands according to the standard precautions that we talked about earlier. And we want to do that before we use our cell phone, before we use pens, before we touch our face directly, before we use chapstick, anything like that that's going to come in contact with our face. And then we want to make sure that if we're providing care for multiple folks, that we change gloves before we treat each person. So if we have two kids that are playing basketball, they both fall down and scrape their knee, we're going to use one set of gloves to provide care for the first person. We're going to dispose of those gloves properly, and then we're going to use a new set of gloves to provide care for the second person. And then if there's any possibility that blood or bodily fluid is going to splash or spurt, you want to make sure that you're using a mask, some sort of facial shield or mask or eyewear at a minimum. And then, if possible, use a breathing barrier such as face shields before you give rescue breaths. And then carefully remove gloves, and we'll review this in more detail and practice it when we do first aid. But you want to remove gloves without touching any of the soiled parts. So you want to carefully remove those so you're not contaminating yourself in the process. And then just use common sense in choosing the personal protective equipment that's appropriate for the situation. If you have somebody that has a scraped knee, you don't need to wear a gown, you don't need to wear a face shield if it's just a simple scrape. But if somebody is vomiting severely and there's a possibility that it's going to splash, you may want to consider using some goggles or a face shield to provide care for that person. If blood is squirting, certainly we want to make sure that we've got a face shield and a gown to provide care for that person. And again, for those of us in the healthcare field that selflessly are in this field to help others, one of the hardest things to do is fight our instinct to immediately help somebody that's at harm's way. So just like in a plane, before you help anybody else, if oxygen masks drop, you're supposed to put your own on. Same thing with bloodborne pathogens. Before you provide care to somebody, you need to protect yourself from that risk. So get on gloves, face shield if you need that, gown if you need that, whatever protective equipment's appropriate for the situation. Make sure you've got that before you provide care. And some work practice controls are starting with sharps containers. We talked about any sort of needles or sharps, and in the environment we work in, if it's not needles that we're dealing with, it's probably broken glass. That's the other thing that we commonly would deal with. But any sort of sharp that may have any sort of pathogens or blood, bodily fluids on it, we want to make sure that we dispose of that in a sharps container. Again, if you don't have a sharps container, you can use a substitute that's going to be sturdy, puncture-resistant plastic that isn't going to leak, isn't likely to spill. And we want to perform procedures in ways that cut down on, obviously, splashing or spraying any sort of the biohazard material. So, again, once we've got things in a bag, we generally know that, we generally follow that, but once you've got everything disposed in a bag, you've cleaned up after a spill, you've got it in the biohazard bag, just carefully take the biohazard bag and dispose of it immediately. We don't want to just toss it in the van, or we don't want to sling it over our shoulders or toss it to somebody to take. Remove and dispose of any soiled clothing or protective equipment immediately. If there's been any sort of equipment or surfaces that have come into contact with blood or bodily fluid, we want to clean and disinfect those areas immediately. We want to wash our hands using soap and water immediately after we provide care. We should never use the kitchen sink to clean our hands or to clean up after a spill. Always use a bathroom or another facility. Avoid eating or drinking, and we mentioned this before, or otherwise touching getting your hands or any other equipment you've touched close to your face until you've cleaned up. And I mentioned this before, but you can use hand sanitizer if you don't have the ability to wash your hands. So if you're transporting a youth somewhere, you're not near a bathroom, you can use hand sanitizer, but you still get to a bathroom and wash your hands as quickly as you can. And then, again, we need to make sure that biohazard labels are on any container that is holding any sort of biohazard material. So if we use a hefty bag in lieu of a biohazard bag because we don't have those available, we need to make sure that we've used tape or some other material and we've clearly labeled that bag as biohazard material. And then for cleaning, anytime we have a contaminated surface, we should use a germicidal cleaning agent. We use absorbent material where you can use cloth towels to clean up any spills, but we need to make sure that you dispose of whatever you use correctly. Obviously wear disposable gloves and whatever other personal protective equipment is appropriate to clean up the spills. And then in lieu of a germicidal cleaning agent, you can use a solution of 1 part bleach to 10 parts water to clean up after a spill. You can use a germicidal cleaning agent. The trick is you need to make sure that you carefully read the instructions, because a lot of times, especially sprays, are used incorrectly. If you read the labels on sprays, it will say leave in place for up to 10 minutes. But a lot of times what people will do is they'll spray a cleaner on a surface and then they immediately wipe it up. So if you have the choice between spray and disinfectant wipes, the wipes tend to be better because you leave the germicidal agent in place long enough for it to disinfect the area. And then some germicidal agents will dictate the type of surface that you can use it on. So some will specifically dictate that you can't spray it on a porous surface. So some areas, some tile that has grout in between it may be porous. You may have a wood surface that might be porous. So you just need to know what type of surface you're cleaning and make sure the germicidal agent has been approved for that surface and that you use it, leaving it in place as long as it's recommended. Any sort of sharp, such as contaminated broken glass, can be cleaned up with a broom and dustpan, but you've got to dispose of that broom and dustpan afterwards. So if it's safe to do, in lieu of broom and dustpan, you can use various materials like heavy cardstock or 2 pieces of cardboard to scoop up the materials. Just want to make sure that whatever you're using is sturdy enough and you're using it carefully enough to keep your hands away from that material. And then if you get leather goods contaminated, so if you've got a really nice pair of shoes that you don't want to toss away, you can use warm or hot water, soap, and a good sturdy brush to clean those items in lieu of throwing them away. If you have any sort of exposure on your body, if you get exposure on any skin, you want to make sure that you vigorously wash that skin, whatever the infected area is, with warm soap and water, just like we talked about with your hands. You're going to wash it for at least 20 seconds. And in all likelihood, if you've been exposed to any sort of pathogen, any sort of blood or bodily fluid, you're probably going to be doing a lot longer than 20 seconds, but you want to do it for at least 20 seconds. If you have any possible exposure in the nose or mouth, you want to flush those areas with water. If the infection potentially happens in the eye, you can flush the eye with water or with a saline irrigant. Just want to make sure that you turn the infected eye towards the ground. So if it's the right eye, you're going to turn the right eye towards the ground so that you don't infect the clean eye as well. And then if there's any possibility of any exposure whatsoever, you need to report that immediately to your supervisor. You need to report it to HR immediately, and you need to seek medical care. And again, you want to treat any exposure as worst case scenario and just assume that infection has happened. Much better to get medical care when you don't need it than to leave something lingering, not get the medical care when you need it. Because the quicker you get medical care, the more likely it is you're going to be safe for a variety of different potential infections. And then you'll have documentation that you need to complete as well. All right. And there's a couple of references, just if you want to do any additional research or reading on pathogens, and I can get those to you if you're interested. Any questions?